Maintaining a patent airway. Most people that are awake and able to converse and communicate with us clearly have a patent airway. They are able to control the secretions in the oral cavity so that it doesn't affect the windpipe or their breathing. It is the patient that is comatose, semi-alert, unresponsive, and or may have gurgling or snoring type breath sounds that will require us to use maneuvers to open their airway, to create the patent airway. Here we have our mannequin, which we will be practicing with, and on our video slide presentation you can see a person doing a head tilt chin lift. This is one of the first manual maneuvers we will do to open the airway. This aligns the windpipe with the oral cavity to displace or to move the tongue away from the back of the windpipe and passageway. This maneuver, the head tilt chin lift, is used for someone that does not have a potential spinal cord injury. If that person has a possibility of a spinal cord injury, we would keep the head in line and use another maneuver called a jaw thrust or a modified jaw thrust. This maneuver displaces the mandible, the lower jawbone, and draws the tongue up, displacing the tongue from the back of that windpipe and passageway. To aid with keeping the airway open, we may need to use a suction device. Using a cross finger technique or a tongue jaw lift, we would open the airway and then place this suction device, mechanical or manual, to clear that airway of fluid or blood or vomitus. To maintain the patency, we may place in what is also pictured here on your video slide, an oropharyngeal, which looks like the J loop, or a nasopharyngeal airway, which looks more like that nasal trumpet, that long cylindrical straw piece with a big flange at one end. The oropharyngeal airway, that J loop, is measured from the corner of the mouth to the angle of the jawbone or the tip of the earlobe. It is placed in a 90 or 180 degree position and then rotated downwards. We will have demonstrated this in class. Keep in mind that it's only indicated for people or patients that have no gag reflex, because what this will do will stimulate them to vomit, as it stimulates their gag reflex and can become or make their airway more problematic with vomit and other secretions coming up. In other conditions, to maintain a patent airway and the patient has a positive gag reflex, we would put in a nasopharyngeal airway. The nasopharyngeal airway is usually measured by using the victim's pinky. That's to determine the size or diameter of that device. Now the length of the device is then measured from the tip of the nose to the angle of the jawbone or the tip of the earlobe. It is usually placed into the right nair, as the bevel is placed towards the septum and this curvature follows the normal curvature of the air passageway. We would lubricate this device with a soluble lubricant, water soluble lubricant, making sure that we do not place that water soluble lubricant into the lumen of this nasopharyngeal device. It would be on the outside. We'll slowly insert this device, a slight rotation right to left as it's displaced posteriorly through the nasal passageway. The flange should rest directly up against the nasal airway, If for any reason the patient starts to gag in either device being used, it is taken out. Keep in mind that as we place a nasopharyngeal airway, this may cause irritation to the superficial blood vessels in the nasal passageways and cause an epistaxis or nosebleed. Please practice the measuring and insertion of these devices. Please follow along with your skill sheets. Verbalize the indication for when these will be used, contraindications when they would not be used, how you would insert them, when you would remove them. Also practice maintaining and opening the oral airway by use and methods of the head tilt chin lift, the modified jaw thrust, cross finger technique, and the tongue jaw lift. Please practice using the manual and mechanical suction devices, minimizing the time of suctioning to less than 10 seconds. Suction should only be applied when you are drawing the suction device out and that you oxygenate the patient before and after suctioning, as suctioning will decrease the amount of oxygen that is being delivered to your patient. Again, follow along with your skill sheets as you perform these individual skills.